Welcome to the Darcy Wellness Series. During our series, we will present information on complementary and alternative medicine and how these natural, non-drug, non-surgical options can benefit your wellness and your loved ones. Today we're going to talk about what is chelation in ion cleansing therapy and how can chelation help heart disease plaqued arteries, and how does detoxifying heavy metals from the body help the immune system and help the illness. My name is Geoff Darcy and I'm an acupuncturist herbalist at the Darcy Wellness Clinic. And with me in the studio today is Arthur Gertler, a medical doctor with over 30 years of experience and also practicing at the Darcy Wellness Clinic in Natick. Welcome, Arthur.
Thank you.
So what is chelation?
Well, chelation therapy has been used for 50 years as a method of reducing the plaques and the narrowings in arteries throughout the body. And it does this by removing some of the heavy metals, iron, cadmium, lead, through these plaques and actually excreting them through the kidneys. It's one of the only therapies that's been proven to actually reverse the process of arteriosclerosis that accounts for strokes and heart attacks and poor circulation in the extremities.
So maybe we could just go straight into one of our slides, if we could. So this is actually a slide of somebody getting chelation therapy, and what's that bottle dripping in there?
That's the intravenous solution comprised mainly of a synthetic amino acid called EDTA, which binds the heavy metals and is also an antioxidant. And this combination of effects is very effective in removing the heavy metals and toxic components in the arterial walls, and it's excreted directly into the urine within about 6 hours. Okay, and maybe we could go to our next slide. So basically, it's an IV that gets dripped into the vein. This is a synthetic amino acid. That's right.
And how did they find out that this would help and deplaque the arteries?
Well, initially it was used, they were searching for a method to remove lead and lead toxicity after World War II. Yeah. And they discovered by this treatment that it also had significant effects in reducing the...
Because it was lead painters, wasn't it? They were actually painters doing the lead paint, and that was being around the paint got into their blood and gave them lead poisoning.
Yes, that's right. And over the years of doing this, they discovered that it had even better effects on reversing cardiovascular disease.
So they found that some of those people that they were treating to detoxify them of lead poisoning actually cleared out some of their arteries, and their atherosclerosis would improve, or some other heart condition would improve.
That's true.
Yeah,
that's true.
So should we go to our video now of you giving an IV chelation therapy to somebody?
This individual is undergoing a procedure called intravenous chelation therapy. Chelation therapy. This is a process to reverse and prophylax the effects of cardiovascular disease or atherosclerosis. What it does is, specifically in that intravenous solution, is a synthetic amino acid called EDTA. EDTA, and this binds heavy metals and it cleans them up from the plaques in the arteries all over the body as it circulates around in this intravenous infusion. The infusion lasts about 3 hours and then we're done. The dose is calculated according to her kidney function and her body weight. And we do these about once a week, and the full course includes 20 sessions. Joanna has really voiced a concern to have this done because of a past history of exposure to toxicity, which she may tell you about. But this procedure has been done in this country and the world now for about 50 years, and there have been about 1 million people who have experienced these treatments just in the United States alone, many more in Europe, Canada, and Australia. This treatment is felt to work by removing the heavy metals and calcium in the plaques and reducing the size of the plaques so there's better flow through the brain, the heart, and the entire body. And by doing so, it actually extends the ability of the body to handle all insults and improve circulation. It's thought to be, the theory is thought to be that it removes heavy metals, which are a catalyst for free radical formation. These are very reactive chemical groups that serve to cause microscopic damage to the lining of the blood vessel wall and therefore initiate the process of arteriosclerosis with the laying down of cholesterol plaques. Most of this comes out in the urine, and therefore we just have to know the kidney function, that it's normal. If it's not normal, we do a smaller dose, but we do not do patients on dialysis. When this was originally performed, evolved 50 years ago, they found that in addition to the salutary effects on cardiovascular disease, they found that it also helps a whole host of other diseases, including Alzheimer's disease, Parkinson's disease, ALS, kidney disease, and arthritis, the ordinary osteoarthritis that people get. Studies have also shown that, remarkably, when you follow these people out that have had chelation therapy out many years, they have a much lower incidence of cancer of all types, as much as 90% reduction in cancer.
So Dr. Gertler, the idea of dripping this IV into someone's vein, how does that bind with heavy metals and take them out?
What the EDTA does is that it has, in its chemical structure, it has attachment points for most of the heavy metals: iron, lead, cadmium, arsenic, all the heavy metals that are known to be associated with heart disease and the formation of plaques.
Yeah.
And it binds them very, very avidly and removes them right from the plaque directly as it's circulating through the blood after the intravenous solution.
And where are they excreted through?
And it's excreted right into the urine. Right into the urine.
Yeah.
Most of it is excreted within the first 6 hours.
Yeah. So this is pretty remarkable, the idea to have a natural therapy as an alternative to going under the knife. The idea of having surgery for something for bypass is pretty remarkable. How come it hasn't been picked up more mainstream, do you think?
Well, that's a very good question. I think there are some people that feel that there are other methods such as bypass surgery, cardiac medications, and angioplasty that serve the purpose also, but they really do not buy time in prevention. They're just after the fact. This is a true preventative. Some people think it's actually rejuvenating, and it has many other effects on many other diseases, so that it may extend people's lifetime of their blood vessels.
Can you just explain why heavy metals, are toxic and what they do, what bad things they do for us?
Yeah, heavy metals are very notable in that they have a very avid tendency to cause the formation of what's called free radicals, very reactive chemical groups that are found in fertilizers, herbicides, pesticides that enter our body through the food chain. And when these things get into circulation, they often cause microscopic damage on a cellular level to the lining of our blood vessels. The heavy metal content in this speeds up this process of free radicals 1,000,000-fold. So if you can do something to remove the catalyst, the free metals, you've saved the process of arteriosclerosis, really slowed it down quite a bit.
So the idea that pollution, heavy metals in pollution, through herbicides, pesticides, through air pollution, gets into us, and then the body reacts very strongly against it, causing plaquing, or would that be a way to sum up?
Exactly. Through its immune response, it acts like the damage done by these heavy metals is like an inflammatory infection, and it builds up these plaques as a way to cover this up like a Band-Aid.
Right. So the idea of how often, so we saw the video of someone getting an IV dripped into them. How many treatments do you need before it starts to become effective for, say, heart disease or reduction of stroke risk?
Well, the standard recommendation is about 20 once per week treatments, each lasting an infusion of 3 hours.
So it's a steady thing over a 20-week period. Yeah?
Yes.
And you sit in a nice comfy chair for 30 minutes, read a magazine, have a chat with the person next to you. And
that's right.
So it's not unpleasant. It looks unpleasant.
That's right.
There's
no
pain
at all.
The idea of IV, no pain at all, So.
And the solution itself produces no pain at all, no after effects or side effects.
Yeah. So this isn't something that's been unstudied, is just coming, there's something that's going on in Mexico and now happening in Native. There's a very large study underway right now, isn't there, by the National Institute of Health?
Yes, and it's also, the main arm of that study is also ACAM, which teaches physicians how to...
So that's the American College for the Advancement of Medicine?
Medicine, right.
Yeah.
They're administering...
They're all physicians.
That's right.
Yeah, they're all medical doctors.
That's right. And they've run their own studies, and there have been many, many studies published in the literature, double-blind, randomized controls, some as many as 2,400 patients at a time, which demonstrate the success rate, about 85% of this technique in reversing cardiovascular disease.
So I remember you gave me a huge amount of the studies that were done. We posted them on the website at darcynaturals.com. We posted a lot of information about those studies on the website so people can look at them. And since 1930, there's been a lot happening with this. It's still to this day, is it not, the kind of conventional treatment for lead poisoning. People will refer, conventional doctors will refer to chelation for lead poisoning. Is that true?
Yes, yes.
Yeah.
It's FDA approved for lead poisoning.
But this idea that they've noticed other benefits from the treatment over the years that hasn't necessarily been picked up by mainstream medicine and is currently being studied very intensely.
That's right.
By the end. Any idea when that's coming out, the results of those studies?
Well, it's underway right now, and they do plan to do a very large study, so I would assume it would be another year or so.
Yeah, because that would be a very dramatic prevention to add into the system as a non-surgical, non-drug alternative.
Yes, one would expect that the results would be parallel to what's seen in the literature before and would be more accepted in the mainstream Western medicine practice after this.
And how safe is it? I mean, you're getting an IV for once a week for 20 weeks. I mean, how safe is it? And since 1930, it's been going on quite a while, so there must be a good body of evidence out there.
Yeah, it's interesting that you ask that because the safety is one thing that's unquestionable with this procedure. It's often regarded as more safe than most prescription medications and far safer than angioplasty or the other invasive studies. Very, very rarely there's a metabolic problem with low calcium or an extremely 1 in 14,000 allergic reaction to the EDTA, but it's almost unheard of.
Yeah. So the idea that it is for heart disease, it is for prevention, stroke prevention, to detoxify heavy metals, but it's also more widely used for more chronic illness, right? The idea, how does detoxifying heavy metals help more chronic neurological problems?
It's very interesting. As the years progress, we are learning that toxicity, especially that of heavy metals, is a large component of many, many chronic degenerative diseases, especially the chronic neurodegenerative disease such as Parkinson's, Alzheimer's, ALS, fibromyalgia, chronic fatigue syndrome. It may not be the only cause, but it certainly is a very important cause. And if you can detoxify these by removing them, whether by chelation or other means, you've done the patient a great service. And we do know that the same studies in cardiovascular disease prevention for chelation therapy have also demonstrated clear-cut benefits for all these diseases I mentioned, including hypertension, diabetes, Alzheimer's, ALS, multiple sclerosis, and a lot of the autoimmune diseases. As a matter of fact, one study showed that there was a 90% reduction in the future risk for cancer in patients.
90%. So the idea that there's some burden on the body from the heavy metals that is helping the degeneration, neurological degeneration, as an extra burden, not the sole cause of fibromyalgia, but just another aggravation in the mix, another burden for the body to deal with the heavy metals.
That's true.
Yeah.
Well, the heavy metals, by generating the free radicals, can cause so much damage throughout the body. These free radicals are not specific for any one tissue or organ. The ones that are most sensitive to this, the brain, the blood vessels, the liver, and it just poisons the immune system, and that the enzyme systems operating in all these tissues are inhibited by these heavy metals. And so you have a wide array of vast pathologic effects that hamper the natural body functioning.
We're not saying that, because there were these diseases prior to the amounts of heavy metal that are being polluted and getting into our systems. But the fact that they're there on top of the neurological problem enhances it, allows that disease process to go along more quickly?
Yes, yes. There have been cases where people have had detoxification for just heavy metals alone dentists, for example, with suspected mercury poisoning, having early Parkinson's or ALS.
Because dentists use mercury a lot in the fillings and come in contact with it over many decades, right?
Right. And these people have had their diseases totally reversed in the early stages by this heavy metal detoxification.
Right. So you also use a lot of herbs, and a lot of vitamins as part of your treatment plan. It's not just that they come in and get a chelation treatment for a couple of hours every week. There's more to it than that. There's a more holistic approach than that.
Yeah, absolutely. When you detoxify, this is a sophisticated form of detoxification, very specialized. And as with any detoxification, you have to support all the body's functions, the liver, the kidneys, the lymphatic system, and we do give multiple herbs, multiple antioxidants and vitamins during this. We also try to focus on the patients changing their lifestyle and improving their dietary habits, because basically this is really what contributed to the disease to begin with.
So what role does the gastrointestinal tract play in chronic degenerative disease?
Most of our food enters through the GI tract. Most of our toxicity is foodborne, whether it's water or food, through the pesticides, herbicides, insecticides, heavy metals, plastic residues. And also people have micronutrient malnutrition. They're deficient sometimes in vitamins and minerals. They have the wrong balance in the diet, too many carbohydrates, refined sugars. These can all contribute and cause pathology in and of itself inside the large intestine, the amount of bacteria, pathologic bacteria, which can result in microscopic and subtle damage to the lining of the GI tract,
right,
in which partly digested food matter is now entered and exposed to the circulation.
Right.
And this can be very damaging. This can cause what we call autoimmune diseases, where
Would
the body...
Would that be kind of the concept of a leaky gut, the idea of toxins leaking in?
Exactly.
So you were a gastroenterologist for many years, so you're very used to those kind of conditions. What do you suggest your patients do for change the issues around food, and what advice do you give to a chelation patient who's trying to detoxify?
Well, we present them what we think is healthy dietary guidelines, 6 or 8 guidelines, which would not be a surprise to anybody. They clearly recognize stay away from refined sugars, healthy fats, omega-3s, increase the fish intake, avoid too much carbohydrate, whole grain, have lots of fresh fruits and vegetables, as fresh as possible, and organic, and nothing canned or processed.
So basically, shifting. What would a visit look like for you? How would you begin the process of even considering chelation? What would that look like? There would be an evaluation. There would be advice given back in a methodical way. You'd work through these issues with people. Yeah,
we have a consultation on everybody first. It would be at least an hour, and we'd want to have some of the medical records as well, if they're pertinent. We would explain if we felt that they were a viable candidate for chelation, and some patients basically have heard about the technique, but there are simpler and easier ways to do it. Mm-hmm. If we feel that it's the right technique for them, we explain exactly what it is. We have them sign consent forms, and then we do a small battery of blood tests which check kidney function, electrolytes, calcium balance, and assuming that's going to be okay. So you're not just lurching into this procedure blind, you're actually taking the time, doing the blood workups, getting the full workout, considering them as a candidate for chelation. Right. Yeah. Because you have to remember, most of the patients with cardiovascular disease are fairly old. Yeah. They can be fragile, and we want to make sure dosages of the EDTA are correct. It's based on kidney function, and that we cover all areas. So would it be 1 or 2 visits with you at the Darcy Wellness Clinic before they would begin their course of treatment in chelation? Would it be 1 visit? 2 visits? Would just be 1 consultation. Yeah. And then we would launch into the chelation itself, the intravenous. Sometimes we would do a half treatment for the first time. Most of the time we do a full 3-hour infusion. They're monitored by a licensed physician, by myself at the Darcy Wellness Clinic throughout. So how long have you been in practice? Oh, in practice, 30 years. So you've got a lot of experience to guide this whole process with. And so one of the other techniques other than chelation that you have is the ion cleanse. That's true. So what we'd like to do now is just show a video at the Darcy Wellness Clinic of the ion cleanse, and we'll come back and talk about it. Okay.
My name is Dr. Gertler. I'm here helping this individual go through a process of detoxification with this instrument here called an ion cleanse. This ion cleanse was devised specifically to help people remove from their body heavy metal contamination. And what it does is, the way it works is, it sends a very weak electric current through this electrode, which introduces itself to the water, and it creates ions. These ions in the water then supposedly enter the body through the skin surface. They circulate and attach to toxic particles in the blood, and then they're excreted by the body or discarded by the body through a process we call osmosis, and it enters into the water there and does not re-enter the body again. So over the process of the course of treatment, which lasts about a half an hour, you're able to rid the body of many toxic heavy metals, including aluminum, lead, cadmium, arsenic, antimony, and even uranium. As you can see, a lot of color has developed in this bath water since we first started, and the series of colors were in the series of first yellow, and then it got darker to brown that you see here still, and the brown color darkened. Then you got yellow-white foamy material, and then there were little black flecks, and the brown color has continued to darken. The colors mean different organ systems, as it's been standardized through a technique called electroacupuncture many years ago. It doesn't tell us which of the heavy metals are detoxing, but it does tell us vaguely, roughly, where it's coming from. For example, the yellow is from genitourinary tract, kidneys, bladder, female organs. The cheesy yellow-white material usually suggests yeast material, too much in the body. And the dark brown is from liver, and this is all toxic particles. Now, when these are analyzed, there's no protein or any bacteria in here. This is just agglomerated particles that come out in microscopic size and then congeal to form the colors. As we keep on doing these sessions, sometimes the color cleans up and lightens up with 10 or 20 sessions. Other times it doesn't. And if it doesn't lighten up, it doesn't mean that the person is not effectively detoxing, because detoxification has just been found to be based on the number of treatments that we go. And it's usually recommended to do 10 to 20. Sometimes people will test the pH, whether it's alkaline or acid, trying to get it to be alkaline after a certain number of treatments, for example, 10 to 20 treatments. But that's not always done and always necessary. And now we're just about wrapping up, and we're going to turn the machine off. And Erin's going to very carefully clean her feet so she doesn't leave any prints anywhere she doesn't want to. How do you feel, Erin, after this?
I'm feeling all right. My feet are a little cold, but yeah, I'm feeling good.
A lot of people report that they have an increased sense of well-being, better energy after these treatments. And that's one of the reasons they like to do it also.
So welcome back. Dr. Gertler, what's going on with iron cleanse? I mean, the water was so clean at the beginning and so dirty at the end, and that's everybody gets that reaction, right? What's in that water? What's leached out of the body into that water?
Well, sorry to say, what's leached out in that water came from the person who put their feet in it. It looks kind of ugly and swamp-like, but it's really a combination of various toxic heavy metals in a foam-like constitution with other foamy things that gradually gets in there through a process of reverse osmosis.
So it's not necessary, it's not a replacement for chelation, for the IV drip we've been talking about. This is something different. It's not, is it as strong to detoxify heavy metals as chelation?
No. I don't think anything else is, except for something we haven't mentioned, one or two other elements, but they would not be used for cardiovascular disease.
So for this kind of toxicity, where did that technology come from? Who thought this out?
Well, there are a few companies in the country that thought that if we have reverse osmosis to remove ions from drinking water, perhaps we can do that with a foot bath with people and slowly remove these things through the skin, believe it or not.
Huh.
And they experimented and found that very weak direct electric currents would ionize the water and set up a reverse osmosis system, and attach the toxic residues in the body would stream out and leach out through the skin into the bath water.
And who do you normally recommend would do a ion cleanse?
Anybody with arthritis,
Yeah.
rheumatism, gout. It has good value in autistic children, people with skin diseases and allergies such as eczema, psoriasis, and people with chronic pain benefit with swollen, painful joints. It's also been used very actively in patients undergoing chemotherapy and radiation therapy to remove some of the toxic debris.
Maybe we could just go to our last slide now. And there's a picture of, similar to the one, this is our chelation slide, yeah. The detox, there's clean water and then there's really dirty water there. So there's a whole list of conditions, eczema, psoriasis, acne, autism, rheumatic and arthritic conditions. What's the link between all of these conditions? Is it again that you're trying to get rid of the toxins that are a burden and weighing heavily on the body and on the immune process?
Well, that's right. This is mainly for removal of heavy metals, and many of them, 13 or 14 of them. As I said before, it may not be the only process causing these various unrelated diseases, but these heavy metals can cause impairment of the immune system and can affect allergies, and they can be related to gastrointestinal toxicity. So the final common factor here is the heavy metal removal.
Yeah, so this is a relatively new technology, is it? It's been out?
Oh, about 15 or 20 years.
Yeah, and NASA had a hand in the development?
Yes,
Yeah.
I understand they did.
Yeah. So it's another tool in your toolbox for helping people to detoxify.
Right.
Yeah.
And the reason we use this is because it is gentle and very easy to do, unlike many other protocols for removing heavy metals and detoxification, which are really a little stringent, a little difficult to do.
Who should think about the issue of toxic heavy metals in their body? Who should be considering the idea of these possibilities of chelation and ion cleanse? Who might not be considering it now?
Yeah. Well, certainly people with active arthritis, rheumatoid arthritis, osteoarthritis, people with neuropathies, patients undergoing chemotherapy and radiation. Autistic children can find significant relief in the removal of heavy metals. And patients with chronic skin allergic disorders such as psoriasis and acne and eczema can gain benefit.
Great. Well, thanks very much, Arthur. Appreciate it. Thanks very much for joining us.
Thank you for having me here.
Thank you for joining us today in our series on wellness, and we hope that you've learned some more options for non-surgical and non-drug related ways to achieve health and wellness. From myself, Geoff Darcy, and Arthur Gertler, a medical doctor at the Darcy Wellness Clinic in Natick, we wish you and your loved ones health and wellness. Good job.